Equity Group Foundation, in partnership with the Kenya Covid-19 Fund Board, has started delivery of the second consignment of personal protective equipment to public hospitals and final year medical and dental students. Speaking at a handover ceremony held at University of Nairobi's College of Health Sciences, COVID-19 Board Chairman of the Health Committee, Dr. James Mwangi, said EGF has extended donation of PPEs from 18 months to 36 months.
The consignment that we are distributing this week to support our health workers of all cadres in the 68 hospitals that deal with COVID and the final class of 11 universities. This month we are supporting them with 266,000 respiratory masks, 2.7 million three-ply surgical masks, 50,000 reinforced disposable gowns, 2 million pairs of nitrile gloves, 60,000 pairs of medical scrubs, 50,000 coveralls with shoe covers, 300,000 head covers, 55,000 face shields, and 34,000 pairs of goggles, and 200,000 disposable aprons, which will be distributed within the week. Of all the items that I read, none of them is now imported. All of them are produced in the country and has created 4,000 jobs for Kenyans.
Public hospitals in all 47 counties received the PPEs valued at 125 million shillings, while final year medical and dental students from 11 universities received a consignment worth 10 million shillings.
The users in the health centers, they feedback to us about the quality. They write their comments and we take those comments to our factories.
This has been our dream and this has been our passion. It will really go a long way, more so in terms of the safety of the students. You've created a safety net for the students, and we appreciate not only from University of Nairobi Medical School, but all medical students across Kenya.
The Kenya COVID-19 Fund Secretary, Kennedy Kihara, said local manufacture of PPEs has positively impacted the economy, including saving on foreign exchange.
They made sure that we procured locally. What does that do? It makes sure that we protect jobs and indeed create more jobs. Again, the byproduct of that was an injection into our industries such that our industries were able to produce more than we would consume locally and export regionally.
The University of Nairobi Vice Chancellor, Professor Stephen Kiama, lauded equity for inclusion of medical and dental students who, though in training, are frontline healthcare workers too.
This is the second time I'm here with Dr. James Mwangi. The last time we were also receiving and donating PPEs to frontline healthcare workers. He mentioned something to the effect that the students were never in the debate, in the initial debates of consideration for support. But he said in one of the board meetings that the students should also be considered as frontline healthcare workers.
This generous and timely donation comes at a time that medical students have reported and others are in the process of reporting to school. One, it will ensure our protection. We train and practice at the same time. We assist our lecturers, our seniors, while doing procedures and helping our fellow Kenyans.
So that which will be given today is going to go a long way in helping us take the last step towards graduating our student on 11th of December. None of the final year students will not graduate if that student has done his or her part.
It is at the intersection of knowledge, entrepreneurship, and capital that things happen. And value is being created in Kenya. Jobs are being created in Kenya. And this is what our president has been talking about: buy Kenya, build Kenya.
Earlier this year, EGF donated 1.1 billion shillings in partnership with MasterCard Foundation, Equity Bank, and the family of Dr. James Mwangi towards the provision of PPEs to equip frontline medical workers.